Every year, more than 700,000 people die by suicide, and many more experience suicide attempts. Suicide is a tragedy for every family and community impacted by it, with long-lasting effects. We also know that suicide can happen throughout the lifelong of a person. But also we know that in 2019, it was deemed the fourth cause of death from people between the ages of 15 and 29 years of old, globally. It is a global phenomenon, and we know it can happen in any region of the world. But we also know that 77% of suicides happen in low to middle income countries. While the link is clear between suicide, mental health conditions, and previous suicide attempts, we should also keep in mind that many suicides are impulsive and they happen in moments of great crisis. Some of the factors that increase this are experience of loss, of questions of discrimination, loneliness, abuse, violence, and also conflict in any other situation that normally occurs in humanitarian crisis. We also know that stigma plays a part. The stigma surrounding mental health conditions and suicide can prevent someone that needs help and support from reaching it. Even the ones who do try to reach it, we know that stigma and the lack of quality data reporting will act as a barrier. In mental health conditions and suicide, it can limit the number of professionals qualified and trained in MHPSS. And also, it can limit the access or even the existence of the essential referral pathways within communities needed to provide support. We also know that this situation will become worse in countries where suicide is not only a taboo, but also a crime. Within the Red Cross, Red Crescent movement, suicide and self-harm prevention programs are a part of our MHPSS activities within a great number of national societies. These programs usually focus on communities and our work within the communities, with psychosocial activities that have as a goal to raise the awareness within mental health and mental health conditions, but also within suicide. And at the same time, make sure that we decrease the stigma surrounding these topics within those communities. We all have a part to play. And it can be as simple as being aware of how we talk and how we use the language when we talk about suicide. For example, sentences like committed suicide, we should avoid. It reinforces the idea that suicide is a crime. We should instead use sentences as died by suicide, or suicide attempt, or self-harm. For more information about suicide and self-harm prevention, please visit our website, pscenter.org.